Happy Monday! Welcome back to another Milky Minute. It's Morgan here. Today's topic is going to be on late pretermers. Late preterm is classified at this facility as born at gestation between 34 and 36 and 6. 37 weekers, right at that cusp, use your nursing discretion and see if they act more like a term or more like a preterm, because I've seen even 37 weekers, depending upon if they're SGA, IUGR, other in situations like that, still act a little bit late preterm. So check them out, use your nursing discretion. But for this video, we're talking about definitely late pretermers between 34 and 36 and 6. Now, I do get asked what is the best practice for late pretermers. Different facilities do slightly different things. I'm just going to talk about what we do here at this facility. And if you need clarification, everything is on our handout for late pretermers, and this handout should be given to any mama that has a late pretermer. So it's good to familiarize yourself with it anyways. On the front side of the handout, it goes over the common behaviors and the common drawbacks that late pretermers have when it comes to their temperature, their respiratory, their behaviors, jaundice, different things like that physiologically. On the back of the handout, it just goes over feeding instructions of the late pretermer. And these feeding instructions are designed to be followed up until 1 week after their due date. So that's important to tell mamas, is that up until a week after their due date, they still should be following this 1, 2, 3 plan. Okay. So first up for all late pretermers, and this is really our standard of care for all babies, is as much kangaroo skin to skin as possible. Letting the mom know that that baby shouldn't have been born for another month or however many more weeks. So being skin to skin is going to be that outer womb experience, and let that baby grow and develop as close to the womb as possible by being skin to skin. Temperature is better controlled, respiratory is better controlled, as well as blood sugars, and just overall growth and development is maximized when that baby is skin to skin with either mom or dad. Okay. The second thing is whenever you're is feed frequencies. These babies need to be fed often, more on a schedule than, say, your term baby that can feed on demand. These babies need intake at least about every 3 hours, and that is because they are not born with a layer of brown fat like your full-term baby is. Your full-term baby has some brown fat that it burns off to meet its caloric and metabolic needs during the first few days to weeks of life. The late pretermer does not have that, so they need some additional intake, or at least frequent intake, in order to maintain their metabolic and their caloric needs for their development. So every 3 hours, that little one should get something. Now, if the baby wakes up sooner, of course, feed the baby. But at least every 3 hours, that baby should be getting something. Okay, so when mom goes to initiate her breastfeeding, she does want to start by waking the breast up by doing some massage and some hand expression, letting the girls know you got a job to do. It does take 1 to up to 3 minutes for some moms of doing some expression and massage and stimulating the breast to get that milk to come down and to initiate a flow for the baby. And time at the breast is energy. So we don't want baby spending the energy, we'd rather have mom spending the energy. So before she puts baby to rest, tell her to do some massaging, some hand expression, get that milk to come down, and also by bringing that milk to that nipple tip, when the baby goes to latch, they're more likely to be tasting the milk and be more enticed to stay latched on and be more vigorous with their suckle. Okay, so getting that milk going for them. After they've done their massage, they go to latch the baby. Ideally, baby's also still skin to skin with the breastfeeding experience, try to obtain as deep a latch as possible, because that's going to maximize the transfer of the milk. If baby is shallow, baby can be spending energy and not really getting as much. And with these babies, we want them to be getting as much as they can. Okay, so the 1, 2, 3 step right here in this section of our handout goes over how the quality of the feed. If the late pretermer nurses vigorously for 20 minutes, then no supplementation is needed. The second step is if baby only nursed for, say, 10 minutes. then a little supplementation is still warranted, and that can be just mom's expressed milk. So she should be doing some hand expression. This is an appropriate time to bring out the breast pump and see if she wants to do some extra stimulation to get that milk supply going for that baby. Okay, so 20 minutes of vigorous suckling, don't need anything. 10 minutes, some supplementation is warranted. And on our handout, it does say 10 to 15 mLs of supplement, but this can be at the pediatrician's discretion as well. If mom has really easily expressible colostrum, then maybe baby did get more during that 10 minutes, and so there is a little bit more leeway, but the point is baby still should be getting something. Okay, so these mamas will probably be set up with a pump within the first few latches, just because baby's not going to be as vigorous as at the breast to be nursing 20 minutes every 3 hours, every single feed. Okay, it's just most likely not going to happen. So be anticipating if you're going to get an admission for a late pretermer, pull out your pump, get things set up and ready, because that mama's probably going to be needing it. Okay. The third step on the handout is if baby doesn't latch at all. That baby needs supplementation. Okay, just go straight to it, and mom needs to stimulate her breast. For any of the half feeds or no feeds, mom needs to protect her supply. Remember the dyad of the two parts of breastfeeding: feeding the baby, because baby needs nutritional intake, and then stimulating mom's supply to increase that supply, to increase the intake available for baby while we practice the latch. The latch is not the end-all be-all. The latch will happen over time as the baby gets bigger and stronger, and the latch actually happens easier if mom has a better supply. So the earlier we get mom stimulating, either through her hands or through a pump, the quicker that supply comes in, and then the easier the latching then also becomes, and we're protecting that supply and giving mom more power, knowing that she is supplementing with her own milk sooner. Okay, so moms need to be set up with that sooner rather than later, and establish and protect her supply. And the last thing, in telling her to write down her diapers, you know, every pees and poops, letting her providers, and while she's here in the hospital, you guys know what's going in is helping make what come out. There are, of course, many things that we can think of if output kind of stops. So we want to make sure that output keeps going. So telling mom to record, keep her feeding log is absolutely essential. And then also when bringing that feeding log with her to the pediatrician's office after discharge, so that good comparison can be made with how the feeds are going at home, with how the assessment is at the doctor's office, and especially the weight. Watching that weight loss and making sure baby turns the curve and starts gaining weight sooner rather than later by getting mom's milk supply in. Okay, so that is what is on our handout for late pretermers that every mama should be getting. Okay, so anticipate baby's not going to be that vigorous. Anticipate that mom will need to be started pumping sooner rather than later, ideally with her own expressed milk, but then giving her, of course, the other options of donor milk and things like that, and encouraging that lots of skin-to-skin time. Okay, if you have any other questions or need further clarification at our facilities, guidelines for what we do for late preterm care, just let me know. I'll happy to go over it with you, or grab yourself a handout and familiarize yourself with what our facility does. Okay, hope you all have a fantastic week.